Now tell me about your symptoms before our surgery.
Well, I am a letter carrier, so I would walk. I'd start out walking. It's up to a 13-mile route.
Okay, but you're a rancher as
And
well.
I ranch on,
Yeah,
I
okay.
ranch as well, part-time at the post office.
Okay,
And the longest days were 13-mile walk, and I could not do those. I had to drive most of it. So it got to where I drove most of my route. It was very limited walking.
and with
But
the
if
time
I
it got worse, right?
It got worse. If I walked a half a block, the pain would start, and it would just get progressively worse until I could not walk or stand.
Okay, and we call that claudication. And that is a typical sign that your spinal canal is narrowed and the nerve don't have enough space to pass through the spinal canal. How long was pain or symptoms were that bad before the surgery?
I would say it got increasingly worse for about 3 to 4 years. So
3 to
where
4
I knew
years.
I had to do something,
Wow.
or I would be inactive sitting or
Okay.
lying, just totally handicapped, not able to do anything.
What did you do in that few years before the surgery?
It was a very tough time in my
Yeah,
life, a
yeah.
dark time I call it. It was tough. I thought I would never get better. I thought there was no hope, and it was a very, very difficult time for me until I found out about this, what you did, and then I really felt there was some hope.
We noticed what you had is a L3-4 spondylolisthesis and literally stenosis based on the material of the disc pushing on the spinal cord and causing narrowing there. That was your typical symptom, this claudication we call it, that you walk for a minute or two and then you have to stop. So this is a very typical symptoms. And generally for a long time, the only way for us to remove the pressure has been to take the back of the bone off. We call it laminectomy, and that requires us literally fillet your back open to do that. Now, we didn't do that. We did a minimal invasive procedure. We did an olive procedure for you in the L3-4. First of all, how long did you stay in the hospital? Or, tell me a little about this surgery.
Well, I just remember that when I came to out of the anesthesia, the nurse kept saying repeatedly over and over, "It went so well. It just went so well." And she just, I must have heard, I don't know how many times she said that, which is always something when you come out of surgery you like to hear.
Yeah, actually, I have the surgery report that the reason that nurses were very impressed because the nurses in the hospital, they are used for a surgery like yours to take 3-4 hours. Our surgery from the skin to skin took us, I have the record of the surgery here, took us 27 minutes and our blood loss was 24 cc, which is less than half an ounce. And that is, I think, why the nurses were so impressed with the surgery because they're not used for this surgery to be so fast, so efficient. But how long did you stay in the hospital?
You know, I don't remember the exact time frame, but I know my surgery was, I believe, around 7 in the morning, roughly, give or take, a little later. And I was out of there before noon. I was out to the car, I'd wheelchair out to the car, and then I walked into and sat down in the
So
car.
you walked out of the surgery and went home same day within hours?
Yeah, and when she had me on the side, the end of the bed, I remember that. She said, "Do you feel like you could walk with a walker?" I said, "Oh, absolutely." So I walked a little ways, I'd say 30 feet and back, right as soon as I, came to enough, and yeah, it went well.
How long after the surgery were you back to your basic previous life? Like in how many weeks were you back that you say, you could take care of yourself, do basic daily activity, and so on?
To care for myself, it was, I cared for myself, I think, from the very beginning, and no one did anything for me. I could care for myself, but before I felt like I was comfortable, I'd say 6 weeks I was really getting back to some pretty normal activity.
And your normal activity as what with the job you do is a ranching, and this is a demanding work. This is not a desk job, right?
Right, right. Then it's all, it all involves movement, walking. But I will say that I was very careful in lifting.
Good, excellent. Now,
I made sure that I did not lift heavy weights. So.
How long after the surgery did you need narcotic or pain medication, the heavy medication? Not
I was on them for 3 days, and then I became uncomfortable with what it did to me and for me.
The side effects.
The side of I didn't like it, so I quit after 3
but
days.
You were able to quit after 3 days.
I quit after 3 days
of narcotics.
Narcotics, and all I took was Tylenol for I think 3 weeks.
Yeah.
After that, and then after 3 weeks, I quit the Tylenol.
Okay, well, you were on narcotic for 3 days after spinal fusion.
Right.
This is practically unheard of after
Right.
open surgery, because we cause so much damage after open surgery that your body really takes long time to recover, and you need narcotic. Now, this is what we did. We did a 1-level fusion. You had a spondylolisthesis. Most of it is corrected, but more importantly, your symptoms are gone and bone is growing. And here we see that beside that metal cage, bone is growing. Screws are in good position. And practically, I think this is our last visit. Hopefully, I never see you again.
I
Happens
think
you don't
so.
need me.
Yeah.
But thank you so much for the interview. Any other comment, any other information you want to share with us?
Well, I just want to say I really appreciate what you've done for me, because
Thank you. I
I did
appreciate
not ever think that I'd get back to this point in my life to where I feel like I did back when I was in my 30s and I didn't have any back issues. That's basically how I am now. I just am never going to lift as much weight as I did then.
Yes.
But as far as how I feel and my activity, it's the same.
And that with the surgery that was literally 27 minutes and 24 cc of blood loss. So we didn't have to, really destroy your back to get you there. So, well, thank you so much. I really appreciate that.